Good morning, everybody. Thanks for joining us. I hope everybody's having a good day so far. Welcome to the April 17th meeting of the Southside Wellness Coalition. First thing on the agenda, Kenan's going to get it up there, is to approve the minutes of the next meeting. But before that, how about if we quickly go through and introduce yourself? My name is Catherine Maloney. I'm one of the co-chairs of the Southside Wellness Coalition. I live in Charlotte County and I work for Tri-County Community Action Agency and represent them here. Next in the room, Jenna.
Hi, I'm Jenna Dahl. I work at Southside Behavioral Health with Kenan. Yeah, that's pretty much it.
Kenan.
She's fantastic, by the way. Kenan Tyner-Smith, Fiscal Agent for Southside Wellness Coalition, Director of Prevention for Southside Behavioral Health. Glad to be here this morning. I'll popcorn it to Barbara.
Good morning. My name is Barbara Johnson. I'm a community health worker with the Virginia Department of Health. And I'll popcorn it to Alice.
Hey, good morning, everybody. I'm Allison Byrne. I am the Community Engagement and Partnerships Coordinator at the Central Virginia VA Medical Center, and I will popcorn it to Cheryl.
Good morning. My name is Cheryl Parrish. I work for the Virginia Department of Corrections with the Victim Services Unit out of Richmond. I will pass it to Brian.
Good morning, everyone. This is Brian Price with the Virginia Rural Health Association, Program Manager for the REACH grant. And I will pass it to Brenna Link.
Good morning, Brenna Link, Population Health Manager for the Department of Health. I work at Pennsylvania Danville as well as Southside. And I will popcorn it to Allison. I don't think you've gone yet.
I think I just went. Did you guys hear me? Okay, sorry.
Popcorn that to Shelley.
Good morning. My name is Shelley Clary. I'm the education specialist at the Virginia Poison Center at VCU Health.
Hey, welcome everybody.
Glad to have you. Thanks for joining, and up on the screen, you should be able to see. Let's see if we can get it a little bigger. All right. In the room, people have that agenda in front of them. Otherwise, it's up on your screen. Let's go ahead and just take a moment to review it if you haven't been able to review it already. Looks at who is on Zoom, who is present, the announcements that were made. We had a guest speaker, Allison. It was Poison Control Week. We got an update from the leadership team, from the CAD Committee Academy, from the Tick-In, and a veteran upreach. And then we had a lot of membership updates about things that were going on. And last but not least, we had some training announcements. And we'll cover some of the new training announcements coming up here after we have a motion to approve the agenda.
All right.
Would anybody like to make that motion?
I'll motion to approve.
Brenna, thank you, Brenna. Is there a second?
I second it.
Thank you, Barbara. It's been first and been second, and the motion. All in favor, say aye.
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 Any opposition? Say nay. Motion passed. All right, thank you. So moving on, we have a presentation about ACEs, Adverse Childhood Experiences. So let's get that up.
Oh, okay. All right. There's the, okay. Okay.
Right?
Yep.
Keeping Kenan on her toes here.
I know. Let's see. How'd it go? All right. So in honor of All right, yes, in honor of Child Abuse Prevention Month, Again, we'd like to thank all who requested pinwheels from us. We do have pinwheels around the area that are up. And of course, in honor of that, wanted to again revisit the training that we continue to provide throughout our catchment area, both virtually as well as in person when requested, and it certainly supports our outreach with the trauma awareness and resiliency partners. I know it's going to be said later, but I'll go ahead and mention that the next ACEs training we're hosting in the community will be May 15th at the Estes Center in the evening from 4:30 to 6. We have added a new trainer to our training cohort, which is Christine Pennington, the chair of TARP. So she will be there to lead the ACEs training. So to give you guys a little tidbit of what that's going to be like, I'm going to do the abbreviated version that we try to get in front of partnerships and such, with the idea of being able to come back and do longer versions as well. The longer versions, like what Christine will be doing, contains videos, contains a breakout session, contains time for folks to take a break and have a snack or a drink, and certainly be able to talk about the impact of this information on their thoughts, and then certainly share ideas about movements they could make in the community to make a difference as it connects this new information. So with that being said, the ACEs training focuses on understanding that what happens to us stays with us as children. It's the Understanding Adverse Childhood Experience training. It comes out of an effort around informing folks about changing our perspectives connected to the future of public health, but also the idea that we know that the cost of public health care treatments remain in the millions, if not billions of dollars every year. And the idea that we might consider changing, modifying, discussing some of those efforts around our littlest people. And so, again, want to share with you that our central nervous system is wired from the day that we're born. We have millions and millions of neural connections that need to be made. Those connections come from our life experiences with other people through our 5 senses, and then how we sense those life experiences, how we feel them, interpret them internally, impacts the way in which our brain develops, the way in which our various parts of our bodies develop, and most importantly, how we respond to stressful situations, how we deal with stressful situations, again, with the focus on surviving and thriving the next day. And certainly we know that whether I grew up in a relatively dangerous environment, where again, I have to make adaptations to my behavior, make adaptations to how I respond to folks and how they treat me, whether I grew up in a relatively safe environment, which allows me to have the opportunity to focus more on social cues, your body language, your facial expressions. Again, I'm wired to adapt to those environments. But we know ultimately that each person, each of us, regardless of whether we grew up in a relatively safe environment, a relatively dangerous environment, we've all developed adaptations, what I like to call our invisible book bag, that we walk around with on our shoulders, that informs how we respond to stressful situations. And then, of course, it's when my adaptations, each one of us, each of our adaptations collides with somebody else's expectations, I get in trouble. And so we think about, which is very true, we think about these littlest people that come in, our littlest people that come walking into school, little second graders. It's when their adaptations collide with our expectations, they get in trouble and they get suspended and they get sent home. I want to reinforce that there's nothing wrong with people, it's what happened to them, and that I should not be judged for my adaptations. And so that brings me to, well, where did all this information come from? Well, it started in 1994 with the ACEs study that was done in San Diego, California, sponsored by the Center for Disease Control, where 2 doctors that were running clinics connected to heart care, weight care, really just helping folks try to live their best lives. And of course, doctors focus on providing us with care to live our longest lives. These 2 doctors talked to the CDC about the fact that many of their clients that were struggling to make changes to their behaviors, such as substance use, nicotine use, just overall ways in which they responded to stress with substances, talked about struggling in their childhood, talked about some life experience when they were kids. The two doctors got together and made application to the CDC to conduct an experiment in California in 1994. Just to summarize it for you at the time I have, they were able to get Humana Healthcare to give them access to 17,000 people. And of course, why the access to the healthcare? Well, they had to ask these folks some questions about their childhood, which they did. And they also had to be able to ask these folks questions about their current health outcomes, like how they were doing socially, how are they doing emotionally, how they were doing physically, right? And be able to ask these folks these questions. Having access to the healthcare got them access to the survey. So right away, we're talking about folks that already had an advantage. They already had the advantage of having access to good quality healthcare in addition to having access to these questions. What they found, of course, is that in answering the questions about their childhood, which by the way, they were asked basically 10 questions about their childhood. And important to note that they were not asked about the intensity or the frequency of any of these adverse childhood experiences, just whether yes or no, right? For scientific experiment, I can't measure or put any data around intensity and frequency, but yes or no, did these types of abuse, neglect, or household dysfunction happen to you under the age of 18? And then you'll see here that with that yes or no answer, you were then given a score in the experiment, in the study. So if you answered yes to one question, you were given a 1. If you asked yes to 5 questions, you were given a 5. And they found out in this group of 17,000 people that ACEs were very common. In fact, they were highly correlated. Odds are if you had 1, you had 2. If you had a battered mother, then you also probably had a level of emotional or physical neglect. There were correlations made. Now, in addition to that, folks were asked, because remember, we're talking about people in a scientific experiment around how, again, childhood experiences might impact population health. Remember that these are adults that have access to Humana Healthcare, so they're 18 to near the end of life, asked about their childhood, and then they were asked, how are you doing now? How has your physical health been? How's your emotional health been? How's your connection to folks, your societal care, for lack of a better word, how you are in connecting to other people. And what they discovered was the higher in the population, not individually, the higher percentage of ACEs in the population, those with a higher percentage of ACE scores had a higher percentage of health, social, and physical problems. Again, the idea that a connection between higher the percentage of ACEs, again, adverse childhood experiences for kids in a population, higher likelihood that population has a higher percentage of health problems. And that comes from suicide, liver disease, you name it, I've got the slide.
Okay, one question. Is it more of what it looks like, which is direct correlation, or is it more exponential? In other words, is the graph more straight, or does it have that upward, the more ACEs?
Does it
higher
continue?
dose?
Yeah, no, it has.
Greater-
Well, you know what? The interesting thing about the slides that say 5
It says
plus.
5 or greater.
Yeah.
I'll tell you an interesting tidbit about that.
Sure.
When this information first came out, basically to present it, they clustered these folks together. But in reality, yes, it continues to go up. The reason the slides are like this really is for formatting and basically presenting that once you reach a level of higher ACE scores. Now, let me mention too.
So there's not a plateau, like
No,
at 5, it
no,
doesn't
not that I-
plateau,
no.
it just continues to
Right.
rise.
Yes.
And it also doesn't turn into an exponential. In other words, as these things grow, sometime I would think it's not a direct correlation, but then becomes exponential and the curve upward
Mhm.
because of the, I guess. you
It
turn
becomes
the piling
steeper,
on.
it
Yes.
becomes steeper.
Right.
Yeah, I see what you're saying.
Dennis has joined us, y'all, by the way. Welcome, Dennis Damien's joined us with the
Yes.
attendance.
You want to introduce yourself real quick, Dennis?
Yeah, Dennis Damians, thank y'all very much. enjoy coming here on a routine basis.
Awesome, awesome. So again, there's lots of slides with this abbreviated version, but I'm gonna send you guys an email afterwards, since you basically are going through ACES training this morning, everybody that is on the meeting today, and send you the videos that if we have a longer version, I would share some more slides, some reading information materials, all kinds of great stuff will come in the email after the meeting today. So again, jumping to, all kinds of slides connected to that, what they determined was high ACE scores in the population does increase risk of multiple health and social problems. And again, if we're not aware, if we're not making changes, there's an intergenerational transmission of ACEs onto the next. And then this is one again that we would suggest that we talk about, all the time, effort, especially money connected to treatment around topics connected to us living our best lives. We are suggesting that, again, looking at early intervention, looking at young mothers, the smallest of children, really focusing on early intervention activities like we did last weekend with the Infant Maternal Health Summit, which is appropriate time to bring that up, connected to Child Abuse Prevention Month. The work that we do around our smallest of folks, our pregnant mothers, again, those who are the most vulnerable, right? Prevention focuses on who is the most vulnerable. We believe that we could lower the rates of all these various outcomes by connecting to our smallest of folks. Because again, we think about, when I've made adaptations, when my cortisol levels are high, when I'm living in a dangerous environment, as I'm, again, trying to live my best life, using substances such as nicotine, which lowers my level of stress, lowers my feelings of anxiety, and again, get caught up in using those those modifications to do well. To close out here my presentation, I know you're probably wondering, well, when they have done these various studies, and like I said, I'll send you the links of all the additional studies that have been done, ACEs questions that have been added in addition to the 10 across the nation. When they looked at the folks who had high ACE scores, but did not report the high rate of negative health outcomes, what was the difference for them? And what was not reported was any type of magical medication, any type of specialized treatment, but basically 3 core facts. And that is, folks, I had one caring, competent adult, didn't have to be biological. I had someone who knew my name, talked to me about my plans, work with me on being successful, whether at home or at school in some measure. I belonged and I had attachment, which basically scientifically, I'm not a scientist, so I can call this is love, right? Folks who felt love and connected to other folks, and especially around emotional regulation, the idea of someone acknowledging my feelings, allowing me space to express those feelings, that again, I was able to make a connection to other folks. And then ultimately, folks report also being connected to a community, whether it was connected to a faith-based group or a community, any way in which I left my initial place that I called home and traveled to other places where folks knew my name and I belonged to them and I was part of their community. Which is great when we're teaching the ACEs training, because we're trying to encourage folks to tap into their power of relationships, right? That they can make a difference in how other folks succeed by not shaming and blaming them, but rather being more empathetic, developing relationships and making connections with folks, which we know then ultimately through these scientific experiments, that makes the difference, right? We're not going to eradicate all childhood abuse and neglect, maybe within my lifetime, but we can begin changing how we treat other adults, how we respond to other people's adaptations. And again, remind you, it's nothing wrong with people at what happened to them. So with that being said, change is up to us. We won't change any laws right away, but much like how we changed the laws around smoking, when you could smoke in my high school cafeteria little breakout room, which young people these days can't believe. They're like, no way, was there a smoking lounge, Kenan, when you were in high school? I'm like, absolutely there was. And so that idea now is so bizarre, right?
At
Like,
offices were smoking, you could smoke at your desk.
yes,
And then
yes.
it went to the lunchroom.
That's
And then
right.
they eliminated it there.
Exactly, and they want to get down in front of teachers in schools and talk about this. When I say you could smoke, my brother got picked up, he got early release, he could be smoking in the cafeteria lounge before he got released to go work at his job at a local fast food restaurant, he could smoke. So people are shocked to hear about that, which is much the way hopefully another 20, 30 years will react the same way to talking about kids going through dangerous environments, kids not having the support that they need, as well as our adults. So it can happen. It's all up to us by our thoughts, our conversations, and ultimately how we relate to other people. All right. Thank you. Yay.
So I didn't hear it called empathy. But
Yes.
I think, to me, that's a big piece of this, having empathy towards people who are not like you.
Absolutely. I would 1000% agree. Absolutely.
That, and to me, all the people I know that have overcome those kinds of ACEs all have found a place where they feel valued.
Yes.
There's a big difference in how your attitude is. And that's where those other communities, that's where those other places create those safe havens. Because once you are valued, now you have, may not be a biological family.
Yeah.
But it is that mental family, which changes everything about your brain. And that's where I can truly say we cross so many boundaries, diversity, no matter what, because the military, you are a band of brothers and sisters. When you're placed in those kinds of situations, you learn to count on each other and everybody is valued for what they bring to the table. So how do we bring that to our little ones?
Mm-hmm.
Because once they know they're valued and cared for, it changes the dynamics.
Absolutely. And this training focuses on not changing other folks, but changing our perception. And
Right.
once we move our perception away, how we respond to other folks, it does support them.
Well,
It
I
does.
mean, I also think that the training can help the individual only because when you are not aware, you can't make changes.
Right.
When you become aware, that is when change can actually occur. And so by people seeing a presentation like this, it can actually change them too.
Mhm.
In, you know, and I get what you're saying, but I still think somebody who just comes across this and you treating them in a different manner will help them, but them seeing this might make them do the internal work that is necessary or beneficial. I know that's not a purpose, but it's kind of a
Oh, no,
byproduct of.
absolutely, absolutely. And when I've been in places, I've been in different treatment facilities at times, being invited to share this information. I think you'll see folks realize that they need to start treating themselves with more kindness.
Right, not being so hard on themselves.
Yes. You'll see, when you see the tears, it's folks realizing I need to be kinder to myself. That's how I feel about that I share that.
So,
Be kinder to yourself. You're doing a great job.
anybody out in, virtual have any comments or questions?
Oops, did I not?
We can't see you, so
Uh-oh.
we're gonna see if we can see you here in a second.
Yeah, what happened here? Can you see, do you guys see the slideshow still? Oh, no.
We didn't lose it.
I just see you guys on camera. But I didn't have not so much a question, but more of a comment. Just wanted to kind of piggyback off of what Dennis was saying that studies show that veterans and active duty military are more likely to have had more ACEs in childhood than sort of the general population. So just wanted to note that as well. And that kind of ties into some of the work that we do with our military and veterans.
Wow, and can I add, that's, I'm glad you shared that, because something I didn't share that I share in the longer version is that going back to the folks who grow up in a relatively dangerous environment, as I mentioned earlier, you're not making you're making adaptations regardless of your environment, whether it's relatively safe or dangerous. you're making adaptations. And you think about when you make adaptations to do well in a dangerous environment, you've got to be quick to decision making, quick to respond. You're used to a dangerous environment, so you're wired for that. And I've had folks in the past, we've done the group breakout sessions, talk about, well, who in our communities do well in those type of situations? It's first responders. So interesting, yeah, first responders. So who's gonna jump up to the moment of danger? Who's already wired to respond quickly? It's
Right.
first responders.
And are you saying,
Allison,
Are you
can you
saying
send
there's
us
a
information about
correlation?
that? We could also.
Yeah, I'm looking for the link right now. I'll pop it in the chat when I find the link to the study.
I think that'd be really great to include.
No
is
problem.
it, did I understand that there's a correlation between first responders and the trauma? Because they go into those occupations, or are you just saying they've learned to? What? Yeah,
It's a dual-edged sword. Coping mechanisms, some people never learn to cope.
right,
But what you're finding is a lot of the people that have learned to cope from what they had in their childhood, part of their adaptation is to get into it, whether it's a first responder,
That's-
military, those things, because it provides the structure,
Mhm,
the family,
mhm,
because you are now, whether you're a Leo or a first responder, you are now presenting yourself as you work as a team.
mhm.
You are all valued. You learn that empathy for others because you're now learning how to serve,
right.
which a lot of times is a response from not receiving the
Right.
serving in that. It's how you respond to it.
And the second piece I heard was that they're very well adapted
Mhm.
to that flight, fright,
Yes.
that
Mhm.
response. So that's why they are also there, because they are very adapted to that, being able to operate in
Mhm.
that mode.
Mhm. And Cheryl's
Okay.
got in here. Cheryl added a comment. Thank you, Cheryl. Cheryl said ACEs is so important to understand. It helps folks understand why folks act the way they do. The possible explanation behind behaviors. Excellent point, Cheryl. Absolutely. All right, so what did you do you have to show me later?
I just exited out of your PowerPoint.
Oh, okay, cool. All right.
You had it up as like a screen.
Yeah, I know. I still see it down there. Okay. All right, but they see us. That's all. Oh, no, okay.
All right.
All right,
So-
you know what that was. All right, next up
And
on
you-
our agenda is Jenna is gonna talk about an update. She's heading to the second part of the CADCA mini academy next week with Jeanette. Focused on coalition development, and she can talk now and.
Yeah, so I went to the mini academy, when was that, in February? Yeah. And it's all about like training to learn how to function as a coalition and kind of like what a coalition is, what they're supposed to be doing, all that kind of good stuff. I have been working on a community assessment for you all to use. Which is gonna include pretty much everything that we have in our old logic model, and then maybe going back into the logic model and taking a look at that too. But essentially right now, it's just a gigantic binder with every single reference and resource paper that I could find. But I want to add to it because I think that the community that we're actually in is more important than like state numbers. Because my idea is that, I mean, if the state says that these things are going on, but it's really not happening in our community, how do we figure that out unless I ask the people that are actually in there? So Kenan, if you move your mouse a little bit and you go to more and then go to polls and quizzes.
Okay,
Yeah, now pick 416 coalition survey.
okay.
And you guys.
You want me to launch it?
Ooh, don't you?
Am I launching it?
Another one, because I used the link when you gave me to write on it.
That's fine.
Do I launch it?
Yes, launch.
Launch it. All right, here we go.
And if you guys could just take a few minutes to fill that out.
What do you think is the biggest problem that faces?
Okay, now it's saying, can they see this?
Yeah, they can see it and they'll answer once they've started answering.
Oh, okay, it says 0, I've answered. Okay, guys, there's a poll in front of you that should have popped up on your Zoom screen. If you will, and we'll take about, what, 4 to 5 minutes, because this could be, well, all right, if you're not seeing that, please let us know. One answer so far, awesome.
Thank you.
You've got on a timer.
No, it's just taking time.
Oh, it's just timing it. Okay, cool. All right, we got 3 out of 3 so far.
Need 2 more.
And Allison dropped those links in the chat for me. Thank you, Allison.
I got 3.
I'm still working on the first one, so.
Now, these poll responses are gonna be saved in the Zoom, right?
I hope so.
Should be.
I hope so.
When it pops up, I'm gonna see if it's gonna ask me if I'm gonna be able to copy it. The Zoom is supposed to save everything. It doesn't save the chat. I do know that. I learned that the hard way. Registration, I know it saves for 30 days. Recordings, it saves for 30 days. I would assume it's gonna save a poll for at least 30 days. But we'll check it as
That's
soon as the
fine,
meeting is
'cause I
over.
can just
We'll
turn
check
it
it before we
off.
turn it off. I know the chat is there unless you turn it off, so maybe that'll stay there too.
So they're able to answer that.
Yeah, I've got 5 out of 5 so far.
All right.
Let's see how many people we have on this screen. There's 1, 2, 3.
Wow, that's
Oh,
it.
that is 5. That's
Okay,
everybody.
and the vote.
Okay. Y'all ready?
I'm ready.
Ready?
Sorry,
Okay.
I'm slow.
How long did you get into Jenna before we
Oh.
leave?
I think Brenna left because there were 6 people.
Okay.
Ryan left, okay.
No, Brian's there. No, she had Brenna.
Yeah.
And poll? Oh, share results?
Yep.
All right.
New details?
View details?
Oh,
Bye,
maybe not.
everybody.
Oh, there.
Oh, wild. Okay.
Uh-oh, it's not anonymous, no.
Let's go back. Does anybody just want to share?
All right,
What
we
they
should-
said?
Hold on, I want
Does-
to copy.
does it
this
matter?
before we-
In this group, again, this is a good community.
Oh,
I'm not- I can't imagine. Is anybody there worried about being anonymous?
You know, copying it before we lose it. Hang on.
I can't imagine this group.
Hold on. Sorry, I'm just trying to do some things real quick.
If you just leave the screen up, it'll save it. You can just go back to the,
Hold on, I'm gonna go. Hang on. Oh, it's not letting me.
while we're doing that, I'll say that we had a youth meeting yesterday and I did this with them. And they were very perceptive and it was really cool to see them talk about it. We talked about, I got them to give me a piece of paper. It was anonymous for them. But, and then we just talked about some of the stuff that was on the paper, so they talked about substance use, so I asked them like what substances. And they were saying alcohol, and we identified where they were using them, how they were getting them, so it was root causes and local conditions, which is really cool for a logic model. And then we talked about marijuana, we talked about vapes, we talked about THC vapes, we talked about mental health, and then we talked about kind of like attitudes towards kids from adults and how that kind of affects why you would want to do something, which was really cool.
Made it back.
I made it back. I don't think they noticed all that.
Does anybody want to share what they put on the poll?
I don't mind.
All right, go ahead.
To me, I just see it as an access to overall wellness resources. We're an isolated community, we have a very basic care, but beyond basic care, there's very little around here. I just realized from one of our friends that's becoming a grandmother that there's no places locally now where you can birth the child. You gotta go to Richmond, Lynchburg, Raleigh, Durham, but there's nothing around here.
Yep.
Or Danville.
Yep.
Which again, that's basic, that's almost basic care, and it's no longer available.
Yep.
Yeah.
That right there tells me we have a big issue if we can't even do that. And the number of, I will say teen births here is, from what I've seen, significant too.
I'll ditto that. I said adequate, reachable, affordable healthcare, including access to healthy activities.
Yeah, I would echo Dennis too. I just put a variety of barriers that impact people's ability to access resources, including, I know we've talked a lot about transportation here, and also just having a lack of local resources that are meeting the needs. So that transportation piece is so important.
And they go through it. Yeah, Allison completely agree.
Yeah.
Without the transportation, everybody gives up. They don't do it.
Right. Yeah.
When you have to go 30, 60 miles to say birth a child.
Yeah. Yeah. That is
High-risk pregnancy, that's tough.
absolutely. How long has it been like that? How long has it been, do y'all know, since there hasn't been a local birthing facility?
Less than a year, Allison.
Oh, was
Okay.
it the hospital in
Yeah.
South Boston,
Yeah.
right?
I don't know, does VCU
Nope.
in South Hill doesn't either? I didn't see, I thought they still did.
They
have
stopped, was,
OG,
honestly, it's been about a
BYU
year
stuff.
since
Yeah.
VCU, but Halifax was before that.
Well, Halifax was within the last year and a half, I
Yeah,
think.
yeah.
This area is now considered a healthcare desert, and even more so for pregnant women, like in South Boston. The OBs are pretty much gone. They're now just gynecologists over there, but yeah, I won't even go into it. That was what last weekend was about, and we brought doulas in, we brought midwives in, and people are having to look at those kind of alternatives, which are great alternatives unless you're possibly in a high-risk pregnancy situation.
Right.
And the other problem is that we're finding that a number of them aren't even going necessarily to all of the pre-birth health they need to really understand
Mhm.
what is going to happen. It's not, there is a lack of education across the board. It's, hey, we're just gonna pop the kid out, and that's not quite the way it works.
Yeah, and prenatal care. I mean,
Yes,
you need
they
the
do so.
prenatal care, yeah.
But to have to travel even for prenatal, your appointment, an hour and a half, it becomes.
Right.
for-
Right, and those appointments can be frequent too. So, if you don't have the reliable transportation going 60 miles, once a month or even more, that's a lot.
To take off of work. That was one thing I had to deal with, like, I haven't had a baby, but I had to like take off to do regular stuff, and that was hard, because you have to find a doctor that's an hour away if you want care or whatever, and then that's like a half a day of
Right.
work. You don't even have that maternal, I mean, you don't even have time off, so.
A lot of people don't,
Yeah.
Well, and a lot of people won't, because
They need the money.
Yeah,
They need the money, and otherwise they lose the job.
right. And you won't be able to take off a whole bunch, because they don't consider taking off a half a day for one doctor's appointment.
Worthwhile.
Yeah, exactly.
Anybody else?
Great conversation.
Yeah.
Is there anything else other than resources? I know what we're gonna talk about next month.
Okay, what's that?
We're gonna talk about what resources we do have. What other than resources, anything else? Was there substances? Is there mental health? Is there,
It's the same across the board.
yeah,
I saved all the results.
cool.
I put
We
it-
do have basic mental health and basic, but any kind of advanced. There's not, and even the ones we do, they're limited and overworked.
Mhm. But other than resources, like access to resources, like what else faces our community? Like, are people using substances? Do we have high rates of ACEs here?
Yes.
Yeah,
I believe we have, I mean,
Yeah.
you shared that last weekend.
Yeah.
There are, this
Mhm.
area, I don't know if it's Virginia or our area, has a high ACEs
Mhm. And Virginia does as well.
as a
Yeah.
whole, right?
But anytime you look at to where there are suppressed economies,
Mhm.
if you don't have access, then you only have a lot more ACEs because people try to do it themselves versus getting the help they need. And that's where a lot of those exist, because you have the poor. You have a lot of them that are, shall we say, not getting the educations they needed.
And did you guys have the ACES flyer? So let me share. So if you all could share
Yeah,
for
this one.
us. Yes, in the room, there's a copy. And I want to share on the screen. Please let me share this. Yep, there it is. Where'd it go? Where'd it go? Where'd it go?
yes.
Hang on one second. Hang on one
I don't
second.
know, the last statement.
We are hosting an ACES training
Put together.
right there. Where'd it go? I want to share. There it is. An ACES training in Chase City on the 15th of May. And it says for educators, mainly because we're doing it in the afternoon after school, but it's open for parents, open to anyone who's interested in learning about ACEs. So it's on your screen. It is also in the newsletter that went out Monday. It's
Great.
going to be on May 15th in the evening.
Have we shared this with the chamber in Chase City, seeing as in Chase
Oh,
City?
that's a great question.
Yes. we
It
have.
has,
Shared it with the
okay,
chamber?
awesome.
Me
Me and Tina.
All right,
and
good.
Tina,
All right.
good.
It typically through our marketing department, everything gets shared
The
out.
other place that might be good is, Latricia at SBCC there.
Okay.
She
Yeah,
has
she's-
access to all those
Yes,
nurses and
she
everything.
also, yes, I think I've talked to her.
Okay.
I'm pretty sure.
She's the one's letting us host it there.
Yes,
Yes,
I
yeah.
think I did.
You probably did.
Okay.
She's good about helping.
I'll
Alright.
text, Tina to make sure.
The next thing on the agenda is our SMVF summit.
Oh,
Yay. Where's the flyer? That must be right here. It's gonna be right here. It's just in a different link. There we go. Where is it?
all your stuff on it.
Yeah.
Come on. Yeah. Oh. Yep.
We're really excited about this event. And, we are hoping to have 150 service members, veterans, and their families attend the event. The registration link is up there. Kenan, you want to say a little bit about, what we know is going on?
Absolutely. So we have an agenda. Well, the doors will open at 7:45 with breakfast from Southern Plenty. And then Dennis, along with Sarah Price from Blue Ridge Behavioral Health, will be welcoming folks. And then Sarah will be introducing Ben Shaw from Veteran Services to do our keynote address. And then followed after that, because we are in the Prizery, Jenna and I are utilizing the theater as well as the banquet hall. So folks will have access to both of those big, nice breakout rooms by stairs or by elevator. And the breakout sessions are connected to gaming and gambling with the casino close by. EMDR and its uses, the PTSD and its treatments, substance use treatments, and then Lock and Talk Virginia.
And we're also gonna have a panel.
That's right, a panel discussion led by our executive director of local resources that would like to share. Our Dennis is on that. So we're still growing the panel, but we've got fantastic people.
I'm gonna do whatever Kenan tells me.
She's on the panel, he's on the panel. So anyway,
Good answer, Dennis, yes.
the fantastic, one of the fantastic parts is that we've got such an interest in folks wanting to come and share their information. We filled up close to 20 tables of vendors that are going to be up in the banquet hall. We've got so many folks that would like to come and talk about the needs around local servicemen and women and the veterans and their families, that we created breakout sessions. So the only downside is you're not going to be able to listen to everything because we've got so much happening, but we think that will be rewarding in the fact that folks will say, this was really great. It was actually more than I actually could go and listen to, versus like, oh, this is not, very much. So it's planned an exciting day. Because we have the breakout rooms in 2 different locations at the Prizery, once they've had lunch, which will be in the banquet hall, we're then going to, Catherine is providing yoga and meditation back down the theater. So everybody will come back down to the theater, and then Allison and her partner Natalie will be doing a Virginia Saves presentation for the entire group after lunch. And then once again, after lunch, we'll have 2 additional breakout sessions that will take us to 4 o'clock. So lots of great information. We're not requiring people to go to any particular session. It's just whoever comes in is welcome to go to whichever session speaks to them. And the same amount of seats and chairs will be available in either room. And then we're going to come back together to close out at 4 o'clock in the last half hour. Again, will there be a panel discussion as well as a lock and talk presentation as well?
So please spread the word.
Yes.
Please register if you are able to attend. We would love to have some members assist with our tabling, if at all possible. So that's a outreach to all of you, if you would like to attend and participate at one of our tables, if you aren't already tabling on your own, because I know some of you will be doing that, and we
Some of you are
appreciate that.
speaking too, and Catherine is doing yoga, so we
Right.
would like someone else at the table if we could, maybe.
Right.
And
At least
Jenna
1 or
is
2
coordinating
people.
with our marketing person.
Mhm.
Because it's such a large location and we are hoping to get at least 150 people, we are going to be name tagging people with
Good.
their duty, whether they're at the table, whether they're at the door, whether they're part of registration. We're going to be, starting at 6:30 in the morning, we're going to be basically manhandling all volunteers to make sure that when folks are coming in the door, they know where the bathrooms are, the elevators, the rest, the stairs, and how to get from one very nice breakout room to the next.
Excellent. So if you want to put your name either in the chat, if you're willing to assist for the event, please do so. If you want to email Jenna or Kenan, who?
That's fine, me.
Either one,
Jenna?
yeah.
Either one.
Okay,
If you
chat.
don't know right now, whether you can assist or not, let us know.
Allison, I'm assuming, just like we talked before, you will be there,
Okay.
and you'll have Kathleen there also?
That's all
Yes, at the event I'm gonna be presenting, and I'll be tabling as well. And then Natalie, who is our suicide prevention coordinator, she is going to be there as well.
Okay, did you want to see if Kashan is available?
Kashan?
Yes.
What am
Simmons?
I doing? I can't, my reading glasses are terrible.
Sure. Can you spell the name for me and I can try to email them?
With you, he's the one that always
Oh, I-
escorts your veterans
Oh,
down to the fishing
Okay, I
trips.
thought you could.
Okay.
It wasn't
And I did the
name.
same thing with
It was
Kathleen or Tiffany Johnson,
You got it.
because it would be great to have y'all to be able to team up that way as to, hey, we already have people that are bringing access to this park, but you're also then all of the other things that y'all have available for these veterans.
So you said Tiffany Johnson, and who was the first name? I'm sorry, I didn't catch it.
It's there with you at the Richmond VA. And then, of course, Kathleen is your counterpart at Durham.
She's in Salem.
Oh, Kathleen's in Salem. Who's the one in?
I'm actually not sure who is in Durham, because they're in a, so Tiffany, I think is in Durham. And then, yeah, Katie's in Salem.
Okay.
And Katie did say she's gonna try to attend.
Okay, sounds great. I appreciate it.
Yeah, no problem.
Cheryl's dropped in the chat. Cheryl would like to volunteer. Cheryl, we'll reach out to you.
One of the things I'm looking at.
Jenna's
is-
email is in the chat box. If you want to email her about helping with the day. Please make sure you register. We need to know how many folks we're providing lunch and breakfast from the Southern Plenty.
And if I get enough volunteers, we can do like shifts, so you guys can also see what's going on. I don't want you to just be stuck at the table all day, but.
Oh,
We
yes.
will, yeah, but if I get enough volunteers, then we can have shifts and you guys can look at what else is going on. So thank you, Cheryl. I'll put you on the list.
Now,
Awesome. And this is in the newspaper as of this week. We had a budget for the newspaper. We have a budget for social media. We did not have budget for radio or for TV ads in any way. We really need to get this. I went to the event
PSAs should be
yesterday.
free.
If you.
What?
PSAs should be free.
Okay,
So radios and stuff, it should not cost you a dime.
I
And the
will,
same thing for the local, even to write the article.
I'll reach out to Susan Kite
okay,
and see if she'll write an article on it. Would
Okay.
you be willing to talk to
Yes,
her?
Mhm.
Okay.
well, and again, Susan,
Alan-
the easiest way for Susan is just write the article you want. And have her then put the other part in there of the flyer, just needs to be in there for sure the 2 weeks. For both here and South Boston, the 2 weeks before the event. You know, the two publications, you
Mhm.
don't want it too far out, but those two publications.
I'll talk to her. I'll ask her.
Okay,
and-
cool,
And as long
thank
as you
you.
write it, Susan will put anything in there.
Oh,
And you know,
She'll
just a couple of
usually
pictures.
write it for me.
Oh, You're lucky than I am, then. I don't have the same.
We'll see.
Well, we're a month out from Monday. We do owe
Okay.
the caterer a head
Yeah,
count
I
on
was
May
just about to say
12th.
that.
So
have to
we do
have-
want to try to get as many
Yeah.
folks. I spoke to folks yesterday at the fishing event.
Yep.
Many said they were coming, but they hadn't yet registered. If you could make sure they
Okay, do you
register.
need registrations that early?
Yeah.
Yes, because that impacts our food. It impacts nothing else, but it's gonna impact our food and we don't
Because I
want to run out
can
of food.
always increase the numbers. Because what we're looking at right now is tomorrow night is
Okay.
the fish fry for the VFW, so I'm taking your flyer and stuff
Okay,
Great.
and doing that.
okay,
So the other part is I have not been able to get a hold of yet, but I want to get a hold of Tammy, who's our local senator,
Okay,
to be there.
okay.
Denia is the district commander for the Legion. Gonna try to get him there. And then also I gotta talk to, Dusty Forbes,
mhm,
because I'd like him to see if one, for him to be there. And two, to have whoever is the district commander, then for the VFWs too.
okay.
Because once we spread that word out, that will increase your numbers.
Let's do it.
We want the numbers to blow through the roof.
Yeah.
We
That's-
can go
that's
to
what we want.
what,
Yes,
250?
240.
And that's-
Because the President's
That's gonna be
240.
the hard part though, is on the food.
Yes,
Because
that's the part.
Again, you're talking to a lot of people that don't do it till last minute.
I know.
Yeah.
And so the 12th is our food.
If you could just
Okay.
encourage them at the
It's
meeting
gonna be
that,
like
you know,
the
everything
11th,
is gonna be
because the 12th
fabulous,
is
but
when
we
I
gotta
the
have them.
contact.
Okay, so the
Okay.
11th is when they need, and I mean, we can probably go 10% above.
Right, we
but
can do a little
cannot
bit, but
go
not much.
Much above.
Yeah,
Can we negotiate for 20?
I
What?
don't know, we'll have to ask her.
20%
We can ask
above.
her.
Yeah.
We can ask her. I don't know.
I think it would depend on where we are with registration and. how
Right, and
strict
right
we
now,
are
we're
with
less than
registration.
50, and frankly, most of them are just the people who are
Are vending.
for tabling.
Right, table.
Right, and that's what I mean, that's, the swell of the vets will not be till closer to, I hate to use the term,
Okay,
starting really the 11th through the 15th.
okay.
Because
Well, as
again,
much as
we're
you can
just-
tell them that
If
we
you
just
can
don't
do
want to have
anything
food.
To
Encourage
out.
them, to push
I
them
will.
up that,
I will.
you know,
Yeah, I'll admit, I've been slow so far, because I just had,
Oh, yeah.
So many
yeah,
other things on my
absolutely.
plate.
Absolutely, got you. No worries.
so.
And you can maybe talk to
basically-
Southern Plenty about if we give them an initial number, if we're gonna start like at 65 on the 12th, maybe if there's a possibility that number could go up to
She
get closer.
said pretty much no, because she's
Oh.
gonna have, because it's such a big order, she will have to place the order, and that gives her enough time for it all to ship in.
Oh, okay.
Shipping in,
Yeah,
so it's not being made?
no,
Oh,
it'll
yeah.
be made, but she's gotta have
The
like
ingredients.
vegetables and all that kind of stuff.
It's gonna be we have a nice breakfast and nice lunch planned with that.
And all of the glassware and utensils and stuff they don't have on hand, so they're gonna order all
They
that.
gotta order all that.
Okay,
Yeah.
makes sense.
Okay.
All right.
So we're, sorry.
You did the last minute thing, I know.
We're not used to getting our numbers till Sunday night for Wednesday. I mean, that's just, Allison, help me
Yeah.
here.
Yeah, I hear what you're saying for sure. I'm gonna go. I've been sharing it in my community email, so I'll go ahead and just put a little, addendum on there stating, if you could register by the 11th, that would be wonderful. But yeah, I do hear you. I know also though that like budgets are tight and like people need time to prepare, so it's a tough situation.
And then we'll do a reach out to everybody too, once we get close to that number, like, how many seats are you feeling like you're still gonna fill, even though they're not on that registration?
Well, maybe we all do, that date is before our next meeting.
Our next meeting is,
May
yes,
15th.
yes, we will be, hold on, let me look.
So I would, the 10th is a Saturday.
Yeah, the next meeting is the
11th is a
15th.
Sunday. So,
So we're basically giving her a count on the Monday before the event. Well, the Monday before the Monday, but basically we're giving her 7 days.
okay.
Which if you've got 130, 140 people coming,
Plus
Yeah.
owning a business that runs Monday through Sunday. from
Right,
what I know.
right.
Right,
That's
yeah.
the hard part for them.
Yeah,
Yeah,
and they only have a limited staff where they'd have to prepare that at the last minute, I think is just what she's saying.
right. I
They
think we're
want it
good.
to be
Well, that's
fresh.
3 more weeks. That's 3 more weeks. That's 3
Yeah.
more weeks. And we've got it, like I said, we'll try to get it out as much as possible. and as much as we
Yeah,
can.
3 more weeks before that, but we've got.
Mhm.
yeah, okay.
Okay.
6 before.
Awesome. All right, the other item on here, I just wanted to mention, I know that we've already shared the Overcoming Trauma Through Connection Conference. I know their registration's up to 160, and then most folks have already registered for that. And then finally, we've got Mental Health First Aid on April 29th. That was in the newsletter. If anyone would like to take that class, that's gonna be 2 Tuesdays from now. And then we also have the Southern Virginia Problem Gambling Summit, which I should have right here. Right in here somewhere. Hang on. Want to share that? That's in June.
Have you noticed
So much
how
stuff. So much stuff.
gambling is now mirroring cigarettes from the 70s? Have you seen all the advertisements?
Mm-hmm.
Remember how
Advertising.
I don't watch
cigarettes started the huge advertisements? And then it became, when it, whoops, this is way too much, and they removed them all.
Mhm.
Because now that they've had all the gambling advertisements, you're seeing gambling addictions
There it is.
rising in, again, we're back to an exponential curve,
There we go.
not a flat line curve,
Mhm.
or a straight curve, a
Not
straight,
right, yeah.
flat rate,
I'm just humming through all
straight
this.
across, so it's,
There it
the
is.
same thing is gonna have to happen soon with
There it
legislation.
goes, there it goes.
Taking
Yep.
a lot of
there it
those
goes.
advertisements and stuff off.
All right, so you've seen on our newsletter this week, our latest announcement is please join us for the Save the Date, Breaking the Cycle is Summit on Addressing Problem Gambling. We will be, we are part of that with 2 other CSBs. It will be Tuesday, June 17th from 1 to 5, the Institute of Advanced Learning and Research. Great speakers on tap to talk about that. Please join us if you can. All right.
Is there a fee for that, Kenan, or is that a free
No,
event?
it's no
That's a free
cost,
event?
no cost.
Is that in the casino?
No, it is not. It is not in the casino. All right. And then now we're ready for leadership updates.
All right, I'll give a quick leadership update.
Okay.
So the leadership, team is looking at June 20th to have a coalition building retreat. It would consist of members of the leadership team and interested members in the community. that want to get together and talk about, how, where we're going as a coalition, looking at, the things that Jenna will be bringing back from CADCA that we can implement and diving deeper into that so that we can better serve our community. So that's on June 20th. That's tentative right now. We have to get at least 20 folks in that session, and it is scheduled for a Friday. Some people that may not work for, we may look for an alternative Saturday if people tell us that Friday's not a good day. But as we stand right now, June 20th, we're looking to secure that. If you can let everybody know, Jenna, Kenan, if you are interested in participating in that, we would love people from all walks of life, all different places in our catchment area to be able to attend that if they are committed to our goals and, mission. Secondly, the other thing is, the bylaws came up in January before membership. There was a little bit of contention about some of the wording. So the leadership team decided to go back to committee. That committee has met, and they will be presenting what they believe are some of the solutions to some of the issues that arose at the leadership meeting. We will look at that, and then we will bring that probably to the May meeting and then ask for a vote electronically of the membership that is active, because that's the way it's worded in the current bylaws, to see if we can get the bylaws amended to better represent how the world works today with a hybrid, etc. So,
Okay,
any questions on any of that? Okay,
sounds
and
fantastic.
then I'll go right into member updates.
Okay,
On April 26th, there is a walk in her jeans. It's for domestic sexual violence. It evolves around the fact that a case came up before a judge, and the judge basically said, well, you had jeans on. There's no way you didn't help him get your jeans off. So it was not rape. So this is to commemorate that ruling.
Is
And that-
this local?
Yes, this is local. This is in South Boston. No, the occurrence was not local. Not to our area.
Okay,
Yeah, no, that's okay. No. But this event is local. It's happening in South Boston at the Washington Coleman Center from 10 to noon. And donations are accepted if you want to support that, or if you want to walk, you have basically an hour and 45 minutes to walk a mile in your jeans.
1 mile. Oh, and in your jeans,
In
okay,
your jeans, yep.
what's wrong with that?
would you like a local example?
Sure. Of something that was bad that happened to women or
Yeah,
men.
we
or
had
men.
one of our constituents that we, under domestic violence. It's on the body cam. That the ex-husband pointed the weapon directly at her, but the law enforcement officer that recorded it marked the wrong block
On a form?
on the form. It says it wasn't direct. He just brandished it as opposed to pointing it. So therefore, they would not extend her protective order.
Yep.
Again, it is a sad situation what women have to go through
Mhm.
just to make them and their families, children safe.
Yeah, to live their lives.
Yes.
That's right, Jenna, you're right. So that's what's going on.
How do you think those children feel under ACEs with that kind of a situation?
Yeah, that's right.
Other member announcements?
Just to piggyback kind of off of that sad topic, we do have a 10-week virtual group that is going to be starting on May 7th. That'll be run by a VA clinician. It's specifically for women veterans who have experienced intimate partner violence. And the name of that group is Power to Change. I'm happy to send the flyer out to you all if you have anybody that would be interested in that. And again, it's virtual, so no need to travel for that group.
Yes,
Is it
please
specifically
send that
for
to me.
veterans or can anybody?
It's for veterans. It's for women veterans specifically.
You can send that to me, that would be great, and we'd like to include that in our packet of one pagers, if that's okay.
Yeah, no problem.
And is that one of those that, Allison, that can be taught to some of our local folks for them to place that in the bag of tricks that we use? As
You
the
know,
goal?
that's a really good question. So I can ask the group facilitator. I suspect that it's sort of a VA like copyrighted therapeutic, I guess, process, but I'm happy to ask and see if there's any way that they could do like a train the trainer or something like that.
Anything we can do to add to our bag of tricks would be great.
Yeah.
Okay, anybody else? Anybody else? Okay, all right. Questions?
Dennis is your
All right.
first part.
All right, we'll adjourn the meeting at 11:07.
Thank you, everybody, for
Yes,
attending.
thank
Appreciate
you.
it. Have a wonderful rest of your day.
Yes, and see you on May 21st. Please register
Please.
prior to May 12th to join us at the Prizery for our servicemen, women, veterans and their families summit, mental health summit. Thank you all.
Follow up
Have a
with
great
some-
day.
Carol, see you on the 21st.
is there-
Okay.
I gotta save the chat, and then I already saved your
Wait, say it
poll.
again?
On the captain convention. Are there any of those you want me to follow up specifically with? Otherwise, I need to get back with them and say, the
Sure.
coalition is not necessarily ready on this time. Because again, I thought that
We
Wait a minute, I gotta stop
talked
that.
about that, and I think that's it.
Stop the recording. Hang on.
Let's have the, when she gets them off, let's have this discussion because we were kind of, this got pushed out to
How do I
June. We
just-
were thinking
how do
it
I-
would be
how do I do
closer
this?
in. And so I get it. We're
Uh,
now 6 months in. We'll be 6 months in when we do the,
I just hate to leave those people hanging.